alarms. In fact, nearly 40% of results can say there's a problem when there isn't. And that can lead to risky procedures like stents or bypasses you may not need. Raymond, a 75-year-old postman, stayed active with daily walks. He mentioned feeling tired on hills, so his doctor ordered a stress test. One thing led to another, and he ended up with a stent and kidney trouble from the dye used during the procedure. The truth? His fatigue was from dehydration, not his heart. If you don't have chest pain or real breathlessness, ask instead about a resting EKG or a calcium scan. They're simpler, safer, and less likely to push you into risky treatment. Number 2, colonoscopy after the mid-70s. This is the one that surprises most people. Colonoscopy has saved lives, but after 70, and especially after 75, the risks rise and the benefits shrink. The prep is harsh, the sedation affects memory, and the test itself can cause complications. Dana, a 73-year-old grandmother, had 2 clean colonoscopies before. Her new doctor urged another. She agreed. That night, she ended up in the hospital with a bowel perforation and weeks of recovery. There was no reason for that test. If you've had clean colonoscopies and no symptoms, ask about stool tests like FIT. They're done at home, require no sedation, and still catch most concerns. Number 1, whole body CT scans. These are sometimes sold as executive checkups to catch cancer early. They sound reassuring, but they can cause more harm than help. Each scan equals hundreds of chest X-rays worth of radiation, and many spots they find are harmless. Tiny nodules, calcifications that trigger more tests, biopsies, and fear. Marcus, 80 and full of energy, got one of these scans. A small nodule led to a chain of tests. He ended up with a collapsed lung from a biopsy, all for something that was benign. Experts now say, never do a full-body CT if you feel well. If something is truly wrong, like coughing blood, sudden weight loss, or swelling, ask for targeted imaging. Your time and peace of mind are too precious to waste chasing shadows. So there you have it. 5 checkups that may sound helpful but can actually harm you after 70. Bone scans, brain MRIs, stress tests, colonoscopies, and whole body CT scans. They're not always the friends they seem. Sometimes the best care is simple care. Your body has wisdom. If you feel well, trust it. Focus on good food, daily movement, restful sleep, and meaningful connections. That's prevention in its truest form.